Hi there, and welcome to A&P with Dr. O. In this video, we are going to further explore the renal corpuscle. And to do so, we are going to use these figures from the Anatomy and Physiology OpenStax text. Let's go ahead and get our bearings. We always like to do that. This right here would be our renal corpuscle. Inside, we have our ball of capillaries known as the glomerulus. That is correct. And we're going to talk a little bit more about some of the cells associated with these structures, and then we'll talk briefly about their roles as well. The visceral layer of the glomerulus consists of these large cells with little feet-like structures, and they are therefore known as podocytes. If you think of a podiatrist as a doctor that is going to specialize in the foot, podocyte, that kind of helps you remember that these cells, they have these little feet-like structures. What we're seeing here is one of those podocytes. We can see as it expands out, there are these little extensions, these little feet, and they are known as foot processes, or sometimes they're called pedicels. We'll go ahead and label them as foot processes. And then between them, there are slits that are going to allow for filtration. Remember, blood is going to enter through the afferent arteriole here, and then it's going to move through the glomerulus, and then pressure is going to cause fluid to be pushed into this capsular space here, and that fluid then is going to be pushed through these filtration slits, and they're also being shown over here in this portion of the figure. We'll go ahead and get that labeled. Our filtration slits. And then we can even go ahead and draw one in, trying to find a good place to get one. We can even go ahead and draw one in from over here. Again, the extension is the foot process, and then the little slit here, that is going to be the filtration slits. We can see those throughout. This might be another place where we can identify. So here we would have a foot process. And then we can see in between, and then there's another one in between here. We have those filtration slits. If we come back up to our corpuscle, the outer portion, this is our glomerular capsule. This is our proximal convoluted tubule. This is our distal convoluted tubule. And again, those are just helping us to get our bearings here. Now, what I also want to talk about is I also want to talk about structures of the juxtaglomerular complex. This is a complex that's going to help regulate blood pressure and the formation of the filtrate that's eventually going to become urine. And we are going to have, as part of that complex, the macula densa. And then we are going to have juxtaglomerular cells. And those cells are going to be here. And then on this side as well. And then here, we are going to have mesangial cells. And these mesangial cells are going to be extraglomerular. There are also intraglomerular cells among the glomerular capillaries, but we're not able to see those in this particular image. So I'll just mark those as mesangial cells. But again, they are technically extraglomerular mesangial cells.